That's how it will be. So when you go to the dissection hall now, that's where you would see this thing. Very importantly, bones. Please, there's going to be a lot of bones in the MB, in the steeplechase. So there will be a lot of all these long bones, all these your clavicle. They will still bring the clavicle, and they'll be expecting you to identify side. They'll be expecting you to identify sometimes the ridges, sometimes the ends, and they rarely ask about attachment. But identifying of side clavicle, that would be a very good question. They'll bring all these bones again. They could bring the hand bone, all those hook up hamate. Basically the bones, they'll bring it, and then they can bring prominent landmarks on the bones, like the intertubercular circles of the human. It's just basic stuffs. The epicondyles, they could bring the femur, the trochanter, the greater trochanter, lesser trochanter, all those stuffs, those ridges, those posterior ridges, those olecranum fossa. They could just shade it with chalk. So that's basically what you see. The hip bone, you're going to see it, the different parts, the ischium, the pubic part. They will still ask, even those inferior rami, they will ask those kind of stuff, those greater sciatic nerve, greater sciatic notch, lesser sciatic notch, those anterior superior iliac spine. They will just shade it, and they are expecting you to identify, and even also the side too. Then they can bring tibia and fibula. But I know fibula is confusing. I was expecting to see a lot of fibula during our exams, but thank God the fibula was not coming for identifying of sites. So that's basically for the bones. But very importantly, because you're in 300 level and you're about writing these exams, they will bring a lot of head and neck bones. That is for sure. So expect the ribs too, those inferior borders, the neck, and all of that. Expect the vertebrae too. But then now coming to the head and neck, expect the cervical vertebrae, all these atlas and all those axes and their processes. Then for the head and neck bones, they are going to bring it. Usually they bring it one piece. They'll bring vomer, they'll bring occiput, they'll bring the parietal bone, they'll bring the different bones piece by piece. But during our time, they did less of that. They did more of the entire bone. But you should be able to know those bones. At least if there's a sphenoid, you should be able to know the greater wing, the lesser wing, the pterygoid process, all those stuffs, basic stuffs, the foramens. And then for your skull, you should know all these foramen ovale, all those foramens. You should know what passes through, because they could just probe it and be asking you what passes through it. Or foramen magnum, for example, they will just probe it and ask you what are the structures that pass through it. So those are the things that you're supposed to know about. You should know single bones, know all the bones of the head and neck, the foramens, what passes through them. Then the nasal bones. Then for the neuroanatomy aspect, you'll be expecting they'll bring the brain. Basically they'll ask you about the spinal cord. Sometimes even if they don't have a spinal cord section, they can photocopy, they can print a spinal cord section, and they're expecting you to identify parts of it, like the anterior horn, the posterior horn, the central equiductal gleamat, I think. Then those just parts of it basically. So you should be able to know the basic parts of it. You don't need to know the deep stuff like those laminar layers of those numbers and all those deep nucleus. Once you just know the basic stuff, you're good to go. Then for the brainstem, of course, they'll ask you things like the olives. They'll ask you things like the pyramids, the decussation. They can just pin it and they will just ask you to identify. They can ask you about the vertebral artery, how it comes and joins, and maybe they'll just pin the artery and just ask you to identify. Then they could ask you the cranial nerves. They could just pin them as they are passing. The optic nerve, they could ask it. The hypophysis, they could ask it. In fact, that even reminds me, in the osteology, they can ask you about the sella tossica too. Maybe parts of it, they can just shade it. Then they could ask you about the cranial nerves as they are coming out. They'll just ask you about them. Then for the brain, basically they can ask you about the corpus callosum, maybe the parts of it, the genu, the rostrum, those parts of the corpus callosum, They could ask you about major gyroses and the central circles, the all those premotor, all those primary sensory, primary motor gyroses, those brokers area, those Winnicott area. They could ask you about the uncles. They could ask you about the what do you call it again? I think I've forgotten the name of the part, but yeah, it's going to still be very basic, sure. Basic, at least if you went through your atlas, it wouldn't be something very far-fetched. Then sometimes if they have good sections, they can probe the ventricles. They could be expecting you to know, is this third ventricle, or they could probe the ventricles. They could also, if they have a good section, they could bring you the basal ganglia, and they're expecting you to maybe identify some basic stuff in them, not something very very deep like that. Then if you have the midbrain, sometimes you could ask about those superior colliculi, inferior colliculi. Maybe some few questions might come from the posterior part of the brain stem. Then yeah, I think it's going to be very basic. So just know that you're going to have, like, I think like 1 line or 2 lines on neuroanatomy, and if you know how to identify neuro, basically you wouldn't have any problem. Gyri, the circles, and all of that. Then for the gross, of course, you're already used to gross, so it's going to just be like rewriting all those tests that you've written before. Upper limb, they'll come, they'll pin muscle, they'll tell you to identify it, bend it. Sometimes they'll pin those brachial plexus. Of course, they will be expecting you to identify one of the nerve, maybe the median nerve or something like that. Then, or the branches. Then they could also pin a muscle and ask you its blood supply. So it's just muscle, lower limb to muscle, and maybe some of the veins, arteries, just basic stuff that you already know, or that you've forgotten, but you should remind yourself. Then of course, if you've been dissecting, even if at least you've been paying some little attention to it, all you just need to do is review. You don't need to kill yourself in that place. Then lower limb to is still muscles. Then you can come to here, the thorax, the abdomen. They will ask you about the pin abdominal wall muscles. They could ask you for their insertion or origin. They could come to the viscera. Yes, the viscera, they will ask you a lot about viscera, like maybe the intestine, like the large intestine. They will ask you about its inner aspects, like the haustras. It could ask you about the tenia from the outer part, the appendices, the omental appendices. And they could ask you about those ileocecal valve. You should be able to identify appendix, for example. You should be able to know major blood vessels and what they supply. Then you should be able to, for the kidneys, you should be able to identify parts of the kidneys, the pelvis, the major calyces, minor calyces, the colon, all those stuffs, how the urethra, the blood vessels that pass through them. You should not forget them. So I think this walkover, basically the liver to its impressions, its ligaments, they are all walkover. So just go through them. The lobes. Then for the spleen to the borders, the poles, they could just ask you. So all these things are just walkover. So that's basically it. So it's not something hard to do. It's something that is just review your residual knowledge and you'll be good to go. Well, lastly, just eat well before you go to that place. I nearly collapsed in that place like 3 times. I was very very tired. So thank you.